Growth patterns of brain matter. Looking at the tissue of the brain, there are regions that predominantly contain neuron cell bodies and dendrites, and regions that are largely composed of just axons. These two regions are often referred to as gray matter, the regions with many cell bodies and dendrites, or white matter, the regions with many myelinated axons. The figure on the screen demonstrates the appearance of these regions in the brain and spinal cord. The colors ascribed to these regions are what would be seen in quote-unquote fresh or unstained brain tissue. Gray matter is not necessarily gray. It can be pinkish because of blood content, or even slightly tan depending on how long the tissue has been preserved. But white matter is white because axons are insulated by a lipid-rich substance called myelin. Lipids can appear as white, quote-unquote fatty material, much like the fat on a raw piece of chicken or beef. Actually, gray matter may have that color ascribed to it because next to the white matter, it is just darker, hence gray. There is a rapid growth of total brain volume in the first 3 years, but the rate of growth is different for gray and white matter. The figure on the screen depicts the pattern of average total brain volume growth across the first 547 days, approximately 18 months, of development, as well as the individual growth trajectories of white and gray matter. The figure on the screen illustrates the relatively faster growing trend of gray matter compared with white matter growth, suggesting that early brain volume growth is dominated primarily by increases in gray matter. The figures on the screen show the growth of gray and white matter for females and males separately, across the first 3 years of life, and for each year after that, until 18 years of age. These graphs further emphasize the rapid growth of brain volume for both white and gray matter during infancy and toddlerhood. Social justice insight. Family income affects the rate of infant and toddler brain growth. Hansen et al. 2013 analyzed repeated measures of brain development of children between 5 months and 4 years of age from economically diverse backgrounds. The data suggests that low socioeconomic status, SES environments, influence the rate of human infant brain development. As the figure on the screen shows, infants and toddlers from lower income families began their lives with similar gray matter brain volumes, but by toddlerhood, they had lower total gray matter compared with those from middle and high income households. As infants aged and presumably had increased exposure to the effects of their environments, the differences in brain volume between children from lower SES homes and those from higher SES homes widened. Furthermore, smaller volumes in this brain tissue were related to greater behavioral problems in the preschool years. Questions to consider. What are the different environmental factors between high versus low SES families that may be mainly driving this data? Are group care facilities that primarily serve high or low SES families different? In which ways? In what ways may infant and toddler care facilities be biased towards serving a particular SES population? What policies and practices can we better implement in an attempt to improve the environments for infants and toddlers in group care?